Everyone, welcome to researchmd.com. Today we're going to continue our high yield topics in infectious disease, my friends. And these high yield topics are based on the questions you commonly seen in USMLE World or MixApp, Ambrose on those examinations, like mainly, let's say, like internal medicine board exam, USMLE test, all those tests. Okay, so let's get into our topic. Before I do that, my name is Dr. PRAMIL. I work as a program director in internal medicine residency and transitional residency, and I teach medical students on a regular basis. Let's go. So what's our question today? We got a 50-year-old HIV infected. This person had HIV for a while. He wants to know, what are the risks if you're having sex with somebody else? What are the risks for that other person? Okay, and what do they have to do? That's a good question on this. So let's look at the labs. When we look at the labs right here, viral PCR is undetectable for more than 6 months. We got a CD4 count is up to 700. So before we go into the question, let's look at some of the things. When do we need to give post-exposure prophylaxis? Okay, that's the main thing about this question we need to know. When do you give post-exposure prophylaxis? So I'm going to go over the list. Chronic ongoing exposure. If somebody is having sex for a very long time, and then you don't have to do any prophylaxis. Second one, pre-existing HIV exposed based on the lab. Okay, that means you have to check the lab. If you know the lab of the person who got HIV, if they have undetectable viral load and CD4 count greater than 500, you don't have to give post-exposure prophylaxis. Exposure to intact skin, not needed. Exposure to non-infectious bodily material like urine, saliva, stools, and sweat. Close contact in absence of blood or sores, like kissing, mouth-to-mouth CPR, and human bites. Exposure to solid bore needles, blood contact, without blood contact. Okay, so in these situations, you don't have to give post-exposure prophylaxis. Examination might ask you that. Now we're going to come back to this patient, right? Does the exposed person need prophylaxis? What do you guys think? Yes or no? The answer is no. Okay? The answer, no, you don't have to give a post-exposure prophylaxis in the patient because it meets the second criteria, pre-existing HIV and exposed based on the lab, undetectable viral load, CD4 count greater than 500. So we have undetectable viral load, CD4 count 700, no post-exposure prophylaxis is needed. Okay, so the teaching point in this is the one right here. When do you give post-exposure prophylaxis? You got a large number of things we need to remember, but make sure you just kind of go through. In this particular patient, you got undetectable viral load and CD4 count greater than 500. No post-exposure prophylaxis needed. Thank you so much for watching. God bless.